Hello everyone. So, it has officially been a year since I tore my Achilles and had surgery on it. So, I thought that I would update everyone 1 year post-op. So, let's get started. I do need to put a disclaimer. I am not a doctor. I don't know. I can't recommend anything for you. So if you do listen to this and take it into your own life, I am not responsible for it because I am not certified for that. So don't sue me. Thanks. I do have my notebook here, so I will be staring at that. So I guess I'll do a little summary of what happened. I was tumbling at open gym, gymnastics gym, and my Achilles couldn't handle the pressure of punching to do a full. And so when I punched, it snapped. And then 3 days later, I got surgery on it. And then was in a cast, was in another cast, was in a boot. And so then I went into physical therapy. So with my first experience for physical therapy for my Achilles, I have done it before for other injuries. It was a lot of gaining strength, and it was more so the physical therapist giving me exercises to do and kind of work on that range of motion and balance. There was not manual therapy done, which personally I think kind of hindered my progress because my scar tissue really built up in the back of my heel, and it was not good for it. That puts more strain and decreases the mobility of your ankle. So that was kind of something that I didn't really realize. I went to a state-of-the-art brand new facility with they're good physical therapists. I'm not saying that they were not qualified or that they were not good. It was just it wasn't the right fit for me, which I realized after I finished that cycle. I wish that I would have spoken out more and told them that I would have liked more manual therapy, which I should have done more research on finding what that therapist does in their day-to-day, what kind of techniques they use. So that is something that you should keep in mind if you are needing any physical therapy for any sort of issue. So I finished up there. I went to school in North Dakota, and for the summer I had an internship in Salt Lake City, Utah. So then I was there for 3 months, and while I was there I did not find another physical therapist. I probably should have, but I didn't want to go through the hassle. And I also was doing hiking almost every single day and staying active, which I probably pushed it farther than I should have, especially only being, January, February, March, April, May, maybe 6 months post-surgery. I kind of pushed it a little too hard, but I figured while I was there I might not ever go back, and I wanted to explore these places. So I do not recommend doing that, but that is what I did. Then I came back to school, and I was still struggling with having pain while I was just walking. I wasn't running or doing anything crazy, but it was still hurting when I was walking. And while I was in Salt Lake City, I was doing exercises that the first physical therapist had given me to kind of incorporate into my workouts during the summer. So I think that also kind of helps strengthen my leg and ankle. But so I was still in pain while just walking. And so I went and found another physical therapist while I was in North Dakota, and she was she was awesome. She did a lot of manual therapy, which I found was best for me. She really worked on that scar tissue, which was kind of a huge problem for me just because it was so thick. And so she worked with tools and scraped that away a bit, and she really decreased the scar tissue that I had around my Achilles, which is awesome. So she did a lot of manual therapy, really worked on massaging it out and getting that mobility back and strengthening it. And so I would work on calf raises. I was not able to do that when I went there. The strength wasn't there, the flexibility was not there. The scar tissue was preventing me from going on my toes. That was a huge problem, but by the end of that I could do calf raises, which is really cool. And we also worked on jogging a little bit. I'm not a huge runner. I don't like running long distances. It's not my thing. But I have been able to run for 5 minutes, which is as long as I want to run, and do just a nice jog and then walk a bit and do a nice jog, walk a bit, which is fine with me. I am happy with that. And it's so amazing that I can walk without any pain now, which is really cool. I do still stretch every day. I think that's really important to keep in mind that once your physical therapy appointments stop, you shouldn't just stop doing what you were working on there. I think that's a misconception is I don't need to do these things anymore. But I have been stretching every day. I keep active and working on those muscles, making sure that they're stretched properly and gaining muscle mass in my leg as well. I think an important aspect to keep in mind is don't compare yourself to other cases. I mean, you should kind of keep in mind and make sure that you're kind of along the same path, just to make sure that you're getting the correct care and what is needed for you. So keep that in mind. But there's some people that I know personally that have torn their Achilles and they're way ahead of me. That's not a good mindset to have because everyone heals at their own pace and you don't want to push things too far. I mean, you want to make sure that you are pushing yourself enough, but you don't want to push that boundary and risk re-injuring yourself and then be set back. That's something that you don't want to do. I will insert my range of motion for my torn Achilles and my healthy one that is good to go. I also will show you my calf raises. You can see that there's still scar tissue that it kind of bubbles in my Achilles, which we kind of plateaued with physical therapy. She got rid of a lot of it. I still hike and stay active, and that's all that I could ask for is to be able to do those things, and I can, and without pain, which is the goal of surgery and PT combined. So the main things to take away from this is find a surgeon that you trust and you think will do a good job. That's the main thing that you want. Number 2 is finding a physical therapist that creates a program that fits you and your life. Not everyone is the same, and so it needs to be catered to what works best for you. And the third thing is to stay up with your exercises and stretching and continuing to do those things that you learned in PT once you finish that program. You don't want to just quit doing things because that you'll revert back and lose that progress that you worked so hard for. So overall, I think I'm healthy and I'm happy with how it turned out. Hopefully these videos have helped you if you were recovering from an Achilles tear or learning to use crutches or are just curious on how the recovery process is. If you did find them helpful, please give it a like if you want to. You don't have to. Subscribe if you want to see other videos, and I will see you in the next one. Bye. Oh, and there's a lot of exercises. No, there wasn't. What's the term? No, lay down. No.